Equipment, instrument, and lab test. Introduction. The following is a short list of the equipment of a ward, floor unit, important materials for routine work and names of some frequently performed laboratory tests. Topics to be covered. Doctor's equipment. Equipment in the patient's room. Working materials and other equipment on the ward. Laboratory test. Doctor's equipment. Things a doctor carries with him. Generally, name tag, ID card, and white coat is a part of the dress code of all the doctors. A doctor also has to carry a surgical mask with him all the time. He has to carry a pager, or the whole paging system with him, as it's a part of the communication system in any emergency situation. Things in a doctor's bag. Stethoscope, an acoustic medical device for auscultation, or listening to internal sounds of a patient's body. Reflex hammer, a medical instrument used by practitioners to test deep tendon reflexes. Testing for reflexes is an important part of a neurological physical examination in order to detect abnormalities in the central or peripheral nervous system. Tuning fork, tape measure. Neurological pin, calipers, ruler. Lamp, flashlight, clipboard. Otoscope specula, a medical device which is used to look into the ears. Ophthalmoscope, a primary instrument used to test the health of an eye during an exam. Sphygmomanometer, an instrument for measuring blood pressure. Manometer, an instrument for measuring the pressure acting on a column of fluid consisting of a U-shaped tube of liquid. Hand bulb, tourniquet, is a device which applies pressure to a limb or extremity in order to limit, but not stop the flow of blood. Head mirror, ENT surgeon. Notebook, pen, marker. Equipment in the patient's room. A short list of equipment in a patient's room is described below. Bed, mattress, bedsheet, blanket, bedcover, pillow, gown, privacy curtain, bedpan, receptacle used for the toileting of a bedridden patient in a healthcare facility, urine bottle, diaper. Heating blanket, heating pad, used to heat body parts to manage pain. The lights, the light switch, bedside lamp. The patient's side tray, locker, hanger, food tray, overbed table. TV set, air conditioning, heating. Figure. A patient's room. Toilet, shower, commode, wash basin, water faucet, two-way water tap used in a restroom, mirror, towel, paper towel, toothbrush, comb. Wall picture, usually a patient's chair. Waste paper basket, disposable plastic bag. Figure. Intravenous stand. Working materials and other equipment on the ward. A short list of working materials of a healthcare professional can be listed like: syringe, needle holder. Vacutainer, a blood collection tube used to collect blood samples for laboratory testing. Tube, cap of the tube, label. Needle, needle dispenser, needle disposal or sharps bin. Gauge, 18 needles, disposable needle. A rubber glove, a sterile gown, a sterile field. Face mask, disposable cap. Figure. Vacutainer. Disinfectant, iodine. Betadine. Betadine is a topical antiseptic that provides infection protection against a variety of germs for minor cuts, scrapes, and burns. Chlorhexidine, a class of drugs known as antimicrobials. It works by decreasing the amount of bacteria in the mouth. A swab, a small piece of soft, absorbent material used to clean wounds, an alcohol swab, a dressing. A lubricant, for example, for the rectal examination. A disposable cloth. A glass slide. Figure, iodine and swab. A cannula, a thin tube inserted into a vein or body cavity to administer medication, drain off fluid, or insert a surgical instrument. An indwelling catheter, a closed sterile system with a catheter and retention balloon that is inserted either through the urethra or suprapubically to allow for bladder drainage. A central line. An oxygen face mask, a nasal oxygen cannula, the oxygen bottle. A tongue blade, a tongue depressor, a cotton tip applicator, cotton wool buds. A spinal needle. A band-aid or plaster, tape, bandage, dressing. Figure, cannula. Other equipment on the ward. A short list of other equipment on the ward is given below. The chart, previous medical records. Intravenous bottle, intravenous pole or drip stand, intravenous line, intravenous piggy bag, intravenous PB, intravenous pump. Pill, tablet, capsule, powder, drops, ointment, lotion. Adapter. Heparin lock flush. Heparin lock flush is used for flushing an intravenous catheter, which helps prevent blockage in the tube after you have received an IV infusion. Ampule, vial tray, used for secure packaging of different medical vials. Normal saline. Nebulizer. A nebulizer turns liquid medicine into a mist to help treat patients' asthma. Refrigerator, freezer, ice machine. Graded or measuring cylinder, container. The crash cart, the crutch. The walker, the walking frame, the wheelchair, the stretcher. The pneumatic tube system, the telephone, an extension. The water fountain. Figure, nebulizer. Laboratory test. A list of some frequently performed laboratory tests is given below. The hemogram. A group of tests performed on a sample of blood. CBC equals complete blood count. WBC equals white blood count. Erythrocyte sedimentation rate equals ESR. The urinalysis. Used to detect and manage a wide range of disorders related to urine, such as urinary tract infections, kidney disease and diabetes. Liver function tests, LFTs. Blood tests that measure different enzymes, proteins, and other substances made by the liver. ALT, AST, AP, protein, albumin, bilirubin total plus direct. BUN, blood urea nitrogen. Measures the amount of nitrogen in blood that comes from the waste product urea and detects how well the kidneys are working. Blood chemistry tests. Commonly referred to as a CHEM7 because it looks at 7 different substances: sodium, potassium, chloride, HC03, BUN, creatinine, glucose, found in the blood, is one of several tests that are routinely performed after surgery to make sure the patient is well in the days following surgery. Thyroid function tests, TFTs. TFTs are used to help diagnose decreased and increased thyroid function, hypothyroidism and hyperthyroidism respectively, which can be due to a variety of thyroid diseases, or occasionally, disorders of the pituitary gland. Arterial blood gases, ABG, measures oxygen and carbon dioxide levels in the blood and also measures body's acid-base, pH, level and shows how well the lungs, heart, and kidneys are working. Lipid panel. A combination of tests conducted together to check for any risks of coronary heart disease or as a preventive measure to check any risks. Blood glucose measures the amount of glucose in your blood. Blood cultures, a test that checks for foreign invaders like bacteria, yeast and other microorganisms in the blood. Gram stain, a lab test used to detect bacteria or fungi in a sample taken from the site of a suspected infection. Gastrointestinal tests, X-ray examinations of the gastrointestinal, GI, tract, esophagus, stomach, small intestines, large intestines, and rectum that helps to find problems in these organs. Pituitary function tests, a repeatedly performed blood test to detect excess or deficient hormones releasing from the pituitary gland. Pulmonary function tests, PFTs, a set of non-invasive tests that show how well the lungs are working. The tests measure lung volume, capacity, rates of flow, and gas exchange. Renal function tests, simple blood and urine tests that can help identify problems with the kidneys. Coagulation tests, COGS, a combination of tests that measure blood's ability to clot and how long it takes. Testing can help assess your risk of excessive bleeding or developing clots. Stool measurements, a series of tests done on a stool sample to check for color, consistency, amount, shape, odor, and the presence of mucus in order to help diagnose certain conditions affecting the digestive tract. Urinary measurements, tests that detect or measure several substances in the urine, such as byproducts of normal and abnormal metabolism, cells, cellular fragments, and bacteria. Cerebrospinal fluid, CSF, a group of laboratory tests that measure chemicals in the fluid that surrounds and protects the brain and spinal cord. Electrocardiogram, ECG. An electrocardiogram, ECG or EKG, is a test that checks how your heart is functioning by measuring the electrical activity of the heart. Summary. A doctor has to carry a surgical mask with him all the time. A cannula is a thin tube inserted into a vein or body cavity to administer medication, drain off fluid, or insert a surgical instrument. An electrocardiogram, ECG or EKG, is a test that checks how your heart is functioning by measuring the electrical activity of the heart.